Recording. Okay, great. Good morning, everyone. Thank you so much for joining the Happy Health webinar on this International Menstrual Health Day. So for today's session, we wanted to take the opportunity to, first of all, celebrate World Menstrual Hygiene Day, and then figure out a lot of actionable strategies on how to tackle menstrual health in terms of promoting health equity, and also trying to create more engagement and diversity within your organizations. So this is going to be about 60 minutes, and we're going to focus a lot more on menstrual health and productivity in the workplace, both in the Philippines, but also because we have highly esteemed speakers from across Southeast Asia with a lot of experience from Lindsay. So we're going to deep dive a little bit also on other learnings from other regions. So maybe first, you want to set the scene a little bit as to why we're here, and I guess like why Happy Health is promoting this topic specifically. So today, what we want to do is, first of all, bring more awareness around the importance of menstrual health in the workplace, why is it important, and what is an important aspect of women's health in general. Provide specific insights and data around the importance of menstrual health, and also talk a little bit more about affordability of period products. And then also, if you stay until the end, you're going to be able to see also our new product launch for menstrual health to promote menstrual health equity in the workplace. And then you're going to get the opportunity to sign up for exclusive pilot, where you're going to get highly discounted rates. So please stay until the end to be able to see that. And then obviously we're going to also talk about that process of encouraging and promoting the conversations in the workplace around women's health. You can access that QR code. We've built a workplace guide, a set of workplace guides around women's health. We actually cover menopause, endometriosis, and women's health in general, with more to come. This is a free tool, so feel free to use it. And obviously share with us your learnings. You can use the Q&A box at the bottom for questions. We will do a Q&A also, but feel free to just add your comments, questions, insights. Very much looking forward to that. So before we dive in, I want to turn to welcome our speakers. So we have Lindsay Davis, who's the founder of the Femtech Association Asia. We work really closely with Lindsay, and as Happy Health is also a member of the Femtech Association. Very incredibly, I would say, appreciative of the fact that you've put together this community of other Femtech companies in Southeast Asia that of various different sizes, I would say, from like large pharma to even like startups like us, to come together. And of course, then we have also Aya, who is my co-founder at Happy Health and also the CEO of Nala Woman, which is a leading menstrual products brand in the Philippines, focusing on affordability and a lot more on environmentally friendly, sustainable products. So we also have Angel here on the call, who's also from our team, so you'll be able to take a look at the questions that are coming in potentially from the box. So without further ado, I'd like to kick off just very quickly, just talk a little bit about why we're here. Why did we decide to do this webinar? So fundamentally for Happy Health, women's health is our core business. We are a digital health platform for employee benefits, focusing on promoting women's health. The reason we decided to start this company was because we actually saw that there's a lot of gaps in terms of the health accessibility and affordability for women in the Philippines. Sometimes it becomes too difficult to navigate through care, especially if you have different chronic conditions like PCOS, or even if you're going through menopause. These things are typically not discussed, and we know that the right place to talk about affordability of care is usually at the workplace, just because of the prevalence of a lot of HMO solutions in the Philippines. Yet, although these are the right steps, sometimes they're not enough, because most HMOs adopt one-size-fits-all approach. So we are here to try to complement that offering to make sure that employers are making the right investment for their employees' care. So we're here to help in terms of productivity, brand awareness, and obviously impact on the bottom line of the employers. So we have a telehealth service in addition to a diagnostics platform that all comes together with our chatbot. So we'll walk you a little bit through our offering, but so far, like two important data points to call out would be most women lose around on average 23 days of productivity, which this usually is exemplified through presenteeism or absenteeism in the workplace. These are things that these I guess like these productivity losses are usually due to a lot of stress. These are coming a lot of times usually due to menstrual pain or due to chronic conditions that are left untreated, or a lot of times where treatment is not sought at the right time. So this is why a platform like Happy Health coming in will provides care at the point of need would make sense for a lot of employers. And also we do see from surveys, and we'll talk about it a little bit later, is that more than 80% of employees that have polled so far actually are looking for targeted employee benefits for women's health, just because they do see that a lot of their needs currently are unmet. Some quick facts we've seen in terms of women's health, what is the state of women's health globally? So more than 10% of women go through endometriosis or have PCOS or polycystic ovary syndrome. We actually found that this is potentially like a much higher number. And then obviously 100% of women go through menopause. This tends to be something that doesn't get talked about a lot. Yet I think most of us do find out about this either from a family member going through menopause, but we have never really thought about how equipped we are to go through it. And then we see only like about 20% of couples that actually face a lot of different fertility issues. And we talk about fertility issues both from inability or infertility, but also preservation of fertility. As women tend to enter the workforce now in large amounts and staying in the workforce for a lot longer and also holding high senior positions, then preserving fertility is extremely crucial. Then unfortunately, we've seen that only less than 1% of the less than 1% of women of the ages between 25 to 30 plus to 35 to 40 are actually completing the routine checkups. So this is a staggering number because obviously a lot of times these are either covered by an HMO or they are not, but they actually are not completing their routine checkups because they might not know about it. So there's a lack of awareness or there's a lack of access and affordability. And this links to the next point around that more than 18%. This is actually more what women pay more than men when it comes to health. And that's just because of the way we are built. That's just the way of the cost of care that we have additional things that we need to look after. And actually, this is an interesting number because this doesn't show the cost, the hidden cost of many times of how many people skip a lot of those routine checkups and then they go later in time when things have completely when their health has been aggravated. So it is important to see that 18% is actually more important, yet HMO or other health coverage is always on par for both genders and does not account for the fact that there's actually just naturally additional cost. And then why I guess this is important for employers and why we're focusing a lot more on workplaces is that this affects women's productivity. We're going to talk about it a lot more in our panel discussion. So women do complain about those symptoms and they do suffer through the pain. And we need here to distinguish what is discomfort and what is normal discomfort and what is actual pain that has a medical reason. And then what merits medical attention. And then in a lot of the times you'll see that 1 in 3 women do take regular leaves for their health. So this is why we think this is an excellent opportunity, because if we actually look at the depth of the problem, we know that employers are now looking for different diverse benefits they can offer to their employees for scouting new talent, retaining new talent, especially those who are in childbearing years. Then I think the most important thing is to really narrow down and provide a targeted platform like Happy Health for their employees. So quickly, this is we don't want to inundate you with information around what we do. We're gonna have information later on about how you can schedule a demo with us. But what we wanted to do is just quickly show you our offering. So we have built a chatbot. It's called a Happy Chatbot, where you can ask any information you want about your health 24/7 discreet and confidential. NOA is a judge-free zone. You can ask anything you want about it. And then most importantly, you can get resources around your health, being triaged to a doctor if you need to speak to the doctor. But we've all found ourselves Googling symptoms and panicking about it and not knowing what to do next. We've built, I think, a wellness companion in the form of this chatbot that helps you identify the right resources, medically verified information, and then you can also find how to book a consultation with us. This is actually a QR, so you can scan the QR here to go to our chatbot. And I think a lot of us assume that we know a lot about our health, but we've done a lot of polls, and you'll see most people think that they know maybe 3 out of 5, I would say, in terms of level of expertise. So you can test your knowledge here. We have built actually quizzes for your health, and I invite you to take the chance in this lesson and see how many of you actually get a 3 out of 3. It's unpredictably difficult sometimes to know all of those answers. So it does show that even ourselves, like we still need a lot of information from experts to know more about our health. As we mentioned, we have a telehealth service from different varieties of experts, from OBGYNs trained in PCOS or endometriosis or menopause, endocrinology, and even family physicians. We do work with other clinics also for mental health. So feel free to go through our marketplace to take a look at it. And then we have partnered with High Precision, which is one of the largest diagnostic centers in the Philippines. And if you're having a hard time figuring out what is the right test for you, or if you think this is affordable, you know how much it's going to cost you for your care, then you can come to check out our tests, which are bundled. So you can do your annual checkup for women, which includes your ultrasound, your typical routine checkups, or we have already curated other tests in bundles, including for menopause, for fertility, and even for obstetrics. And then finally, how we want to come in and help different organizations is with like a holistic approach, both for the side of the employee with a telehealth service, our chatbot, and also our marketplace, but also for HR and for the C-level executives, and being able to provide data insights around the health and wellness of their employees, and most importantly, around what are the needs of their employees and of the culture of the company to support diversity, quality, and inclusion into action. So I think this is kind of more of our introduction. You can definitely reach out to us later on to book a separate call to go through our program. But I wanted to switch over now to our panel discussion and invite our speakers, so I and then Lindsay. So we're gonna go a little bit, maybe spend the next 20 minutes through a panel discussion, and then focus a lot more on your different insights. So yeah, thank you so much both for joining us this morning. Maybe Lindsay, I'm just gonna switch over here. Maybe I just wanted to start for you, because we mentioned a term that might not be super familiar with a lot of people. Talk about femtech, and I don't think everyone knows what is femtech, and maybe talk a little bit more about the Femtech Association.
Thank you so much. So yeah, so I think I will definitely answer that question. So my name is Lindsay Davis. I'm based out of Singapore. I founded Femtech Association Asia in October of 2021. The idea being that prior to this in Asia, we had not had kind of a professional industry network and industry body that was representing and kind of pursuing what we needed as an ecosystem to support the advancement of women's health throughout Asia in particular, which is where we focus. We're made up of over 75 femtech companies, which again, I'll get to that term in a second, over 75 femtech companies across 9 countries. And we also have overseas companies that have joined us, Bangladesh, the US, the UK, New Zealand, and so on. So it's really great to see that more and more companies, more and more founders, more and more investors, more and more media are really excited about how much activity there is in Asia in the women's health and femtech space. So going back a step, when we say femtech, we're talking about female technology. So, I remember when I first launched and people said, oh, femtech, women in tech. And I was like, well, sort of, given that, now about 80% of our founders here in Asia are women. But at the time I thought, well, no, it's women's health and technology. So the first thing I'd say is, when we look at femtech, we're looking at female technology or anything that has to do with women's specific health. So this could be something like a menstrual tracker. This could be a SaaS platform that's specifically for women's health. This could be a product, even something as, I won't say simple, because certainly, anything biodegradable and organic is difficult, but anything in the menstrual care space. So we actually are talking about products. So I think there's a real range of what femtech means. And the definition now is a bit variable depending upon who you talk to. Here in Southeast Asia, we look really at the Cambridge Dictionary definition, which is products, services, and any electronic, i.e. e-platforms or devices that are specifically for women's health or that disproportionately impact women. Things like chronic illness, mental health, a lot of the burdens that we see coming out of caregiving, and how that impacts the workplace, because people, women in particular, are often burdened with that caregiving. So the term femtech can be quite expansive as far as how large it can be, from women's health to really chronic illness and disproportionately impacting women, to caregiving and even baby care. So, it kind of can go beyond, but maybe that's a start for where we are today on this call, talking about menstrual health and menstrual care on this International, Menstrual Health Day.
Thanks, Lindsay. And maybe I guess we talked a little bit more about how you also are part of, you built Nala, which is in the menstrual care space. So maybe you want to give a little bit of what Nala does and maybe why you decided to start it.
Thanks, Maria. Yes, so I started Nala Woman 4 years ago with the goal of bringing organic and sustainable menstrual hygiene products into the Philippines. This was more of a need that I felt that was needed in the market based on a personal need. I just found that our sanitary care products were limited. They had qualities that I wasn't looking for, which were like 99% plastic or materials that were causing skin irritations. And I started asking, like, could there be other alternatives? And am I the only person in the Philippines that were looking for the same? It was a risk and a gamble, but I knew that I wasn't designing it. I wasn't bringing this in only for myself, but with over like the thousands of women that have bought our Nala products since then, I knew that we were onto something and that we weren't alone. And ever since I started this company, I've been very, I guess, focused on a lot of menstrual hygiene education and awareness. I learned only recently, actually, May 28th started as Menstrual Hygiene Day in 2013, where they really wanted to highlight the importance of proper menstrual health and hygiene, which you'd think would be common knowledge, but when you start going around to the offices, to your homes, and to schools, you see that practicing menstrual hygiene is secondary, and it doesn't only mean having access to clean water or hand washing facilities. It also, more importantly, means having access to sanitary pads. Like I read a statistic on a study done by this organization called Free Tampons, that like 87% of women are constantly are caught in the bathrooms without surprisingly get caught in the bathrooms with their periods and not having the proper menstrual care to take care of it. So then they end up using tissue. And then I learned also during talks and talking with other organizations, schools, that tissue is also secondary as to whether it's available or not in all bathrooms. It doesn't have to, it's not special to low income institutions, but like I see it more often than not in offices here in the Philippines as well. So yeah, I'm really glad that we have this one day to spread awareness on, what it means to practice menstrual hygiene management, and just also highlight like what are the impacts of it in the workplace.
Thank you. Maybe if we a couple of topics that you've touched upon. So we've already heard around obviously the importance of hygiene that we all know, but we talked about a lot about health and what Femtech has. So maybe apart from sanitary products, usually, Lindsay, maybe from Southeast Asia, what are the general trends that you see in terms of emphasis around also workplace effectivity? So instead of going to consumer, like what is the importance for a lot of those solutions to be deployed in the workplace?
Sure. So I think the first thing to talk about is when it comes to Femtech in general, menstrual care products really are the most familiar for women in this region. And when I'm talking about this region, I'm talking about Singapore, Malaysia, Indonesia, Thailand, Philippines, and Vietnam in particular. So just to really carve out which countries I'm talking about, we actually just completed a draft of the report with Milu Insight based out of Singapore. We interviewed over 1,000 women in each of these countries to really learn about consumer perspectives and consumer values when it came to their health and their awareness and their needs and their preferences. So the first thing, and I think Aya, you described this so well, of being in the bathroom and saying, I just got my period. What do I do? I'm in the workplace. It's a professional environment, of course. So I think the first thing is noting what women fed back on our report of what they're actually looking for. And Maria, you touched on this with Hattie Health earlier and part of your offering. So first of all, I think it's really important to offer employees something convenient. That can mean, the pads are accessible in the workplace, in the bathrooms, easily accessible and always filled. I think something as simple as that can take away a really big obstacle, which is having to have that discussion with someone else in the office versus just having the care there to be able to take care of themselves and move on with their day. So I think, first of all, making sure that something is convenient, which 64% across those markets said that was the number one thing that they were interested in, was convenience. The second point I'd love to touch on is cost. There is an impact to cost. And I really love that earlier you talked about insurance as well, that we do see women's health costing more. So an example would be in Switzerland, there was a study done, and please know I don't remember the exact quote on percentage, but it was something around the number 12% higher of what women ended up paying in insurance every year, because it's just more expensive to be a woman. So when it comes to our healthcare. So the second thing is we look at cost. The costs of everything are rising. I think it's great to have local companies and local brands like Nala Women and like Hattie Health coming into the space here in the Philippines, but also looking at expanding beyond the Philippines, because we also see a trend in localization, and that's helping with costs. Because international brands, which we found out through our report and my research with the UN SCAP from October until February of this year, one of the points of research we found was that a lot of people were buying international brands that were imported into countries because it was thought of brand perception being higher quality. But that's definitely pivoting now. And I think there's a real move towards knowing that local quality, that sustainability, a closer supply chain, from that ESG perspective, these are starting to be really valued by employees. So I think working with local brands and companies that understand the region and have a local like a local culture awareness, a local understanding, and are able to contribute to the local economy, I think is a really positive thing that employees are looking for as well. And then my final point when we're talking about learnings is the concept of trust. So Femtech Association Asia did a report in Singapore in 2022, a survey in 2022, and similarly in 2023 in Hong Kong. And we found that trust was always in the top 3 qualities that women looked for their healthcare. And when we talk about trust, we're talking about 2 things, one of which, Maria, you mentioned. The first one is around privacy and security, data, making sure that our data is protected. The second part is what I think companies like Hattie Health are offering. When we look at actually medically qualified, trusted, valid, vetted information being shared with the public. And that really is to combat misinformation, because the majority of people really are either looking at their medical providers or online for information about their health. So when it comes to work, one other thing I would really recommend, along with working with a partner who really understands the space, it can help just create that convenience and that cost-effective mechanism for, menstrual care delivery. It's also making sure that we are kind of building trust and knowledge through actual wellness programs within our companies that are incorporating awareness. And that's not just for women, it's all employees can be a part of this and open to this, because women's health is really impacting everyone's health.
Thank you, Lindsay. On this point, actually, this is very interesting because what we've seen so far, and we do, so when we work with certain organizations, we do a lot of surveys also, which we'll talk about earlier. And we didn't put this on the slides, but I'll just share this. Is like there's a question that we ask is like, what is your main source of information on your health? And you'd be surprised about the number of people that obviously refer to social media being like one of the most reliable sources for them, or like the first sources for them. So it's not like we moved away from Dr. Google to now actually like looking up TikTok as your source of information. And there's different practices obviously that are not just appropriate. And I think one of the first things that has always struck me a lot when we started doing focus groups in the workplace was that when we try to understand, and we talk about that with IAs, like we focus on how many people have done a pap smear test in the last year, or how many people have actually been to the OBGYN in the last year. And it's just maybe in a group of 100 people, maybe you'll see like one hand raising or like two hands. And we know that's not right. And when we ask them like, what is the reason because of that? It's like either don't know that this is required. They don't know what the test is and what is the value of it. And then the second thing would be affordability. So some things that these certain tests are not included in the HMO. So I've had conversations with employees who would say that I didn't know that I had PCOS or I was suffering from endometriosis up until I entered the workforce, at which point I could actually afford to go and get tested. I could utilize my HMO. So this is why we know that critically the most important sort of stakeholder in how we define our health is coming from the employer and the benefits they're providing to their employees. But maybe I want to switch gears a little bit and then see, Aya, from your experience when you run a consumer brand, and obviously you do get to see a lot of people complaining about their health, right? So maybe you want to share some insights as to what you have seen over the last 4 years you've been running Nala around this.
Yeah, for me, it's been more like what I've been impressed about is the institutional changes that are happening in terms of how the government is like releasing a lot of bills or acts around menstrual leave and access to free menstrual health education in schools. So in the last 4 years, I've seen two groundbreaking laws passed in the Philippines. One was seeking to grant women a 2-day menstrual leave, fully paid. The other one was to grant them menstrual leave at 50% pay, and which was already a big thing. But what was interesting to me was that the conversations around it revolved around how to be inclusive, how to assess this in a non-discriminatory way. What are the HR managers trained? Are they receiving proper training to, identify that these are legitimate reasons, and that are the employees not, abusing these types of leaves? And, all these conversations again around what about for the men? And that is always the question, like I get asked also by HR managers looking at when we talk about like women's health specific policies or benefits. They always ask, what about for the men, right? But I think the conversation around that has to switch a little bit, and you really have to focus on that menstruation only does happen to women. It's a very natural it's a very natural thing that happens to our body, so that yes, it should receive a lot of a lot more attention. Also, menstruation impacts women, I guess, differently than men. The other things I've seen is that, like last year also, when I mentioned earlier, like laws are now being passed to move for the DepEd and the Department of Health to start providing menstrual sanitary pads in schools. Like this should be free resources in Barangay health centers and elementaries and elementary schools. Like there's a lot of studies out there where female students do lose a lot more days and education compared to their male counterparts because they don't have the proper means to manage their menstruation. And so can you imagine like losing 1 week of school? 1 week of school a month is already a lot when it comes to their education. Yeah, so those are the things that I've seen here in the Philippines. In other countries, I would have to say it would be countries are progressing to removing VAT or, taxing menstrual products just to make it more affordable. It doesn't matter if it's organic, sustainable, or locally sourced, like just removing that added like 10 to 12% a month on such an essential good is a lot of savings for many women, especially when the average cost for menstruation ranges between, between 250 to 500 pesos a month. A lot of people, you'd be surprisingly, a lot of people can't afford that. I would love actually for the next things we do at Hati Health and also for the Femtech Association and would be to study, the impacts and the affordability of menstrual health in the Philippines and all over Southeast Asia. You did mention some studies you saw about period poverty in Malaysia, Lindsay, when we talked before the call. See, we don't have those types of studies in the Philippines. We just know it's a problem, but the gravity of the problem, we're quite unsure. I mean, we just have to look at the statistics. 50% of our population is female, and we're 110 million women. I can't tell you the statistics right now and how many live under poverty, but it's in the millions, I could imagine.
There's a couple of interesting things sorry, Maria, just before you carry on. But the first thing is I thought it was really interesting what you said about policy, because a lot of companies are starting to put policies into place like menstrual leave. The challenge is how are the companies actually looking at their whole culture to make sure that there's not bias, shame, fear of being left behind of a promotion if those days are taken. So it's actually allowing those to be a cultural norm within that corporate culture that people actually feel confident that if they have that severe, the PCOS or whatever it may be, dysmenorrhea is a new word I've learned. So known as period pain and menstrual cramps, which can be absolutely severe. I mean, it can be debilitating for women. So, it's actually making sure that we allow, not only allow, but we make that a very welcome thing to take on in the companies. 26% of women we found say menstrual health and hygiene is the women's health topic deemed most undesirable to discuss due to stigma and fear of criticism. So we have a lot of change to make that women feel comfortable talking about their healthcare needs, just to make sure that, if we don't talk about it, how do we know, Maria, to your point earlier, what's the average experience or what is an unusual experience? And then I think the other thing I wanted to just talk about a little bit was spend per transaction. We've actually now done that study, and which is the report coming out here by the end of June, which I'm really excited about. We've done spend per transaction. As we're all going to make the right guess that Singapore, out of the 6 countries we named earlier, spends the most because the products cost the most here. So that's kind of a natural, association. But we are seeing that where women are spending the most money really does vary. However, there's a lot that is, when it comes to menstrual care, I think there are women who would spend more if they knew what all of the options were. So menstrual care, of course, is obviously pads, and there are other solutions as well that we see. So I think, to your point, how are we making sure that we engage and incorporate programming into our companies as well, or platforms like a virtual assistant, or, the virtual healthcare assistant that we can actually, write in a question that we might not be comfortable asking, but at least we can get an answer we trust.
Yeah, I think that's a thing to your point, and I add to what you alluded earlier. I think the key thing is that one, making those conversations known, because most of the times, and there's a study that we're going to talk about it, is that most of the times people hide the real reason why they're taking a leave, or hide the real reason why they don't. So there's a lot of studies where 2 in 3 women actually are not comfortable sharing with their manager what is the real reason that they're taking leave, or if they're feeling a certain type of symptom, physiological, or even if they're having trouble with mental health challenges. And I think that's, and then obviously in that study, we find out that the reason that happens is because most of the times women are afraid that this is going to hamper their chances to progress in their career. So they're gonna be deemed incapable of performing their duties, or they're gonna be perceived that they are just not available. So like that's not they're not appearing as a good employee. So most of the times then we have to come up with a different excuse as to why, what exactly we are suffering. I've heard a lot in different groups where we talked about it as to the concept of the warrior princess. So, you're someone who just like, you just go through everything, you look after the family, you have to appear as a good employee and everything, but you kind of like, anything that you're feeling or your body is going through, you just have to persevere. So that concept of just perseverance, at some point, we need to understand what is the line between normal discomfort, which is perfectly fine, and we all go through it. It's not pleasant, but it's there. But then something that is, a little bit too much, and potentially there's underlying reason, and then you should seek care. But you should seek care because you can, and it's accessible, but it's also affordable for you. So these are the two things that we definitely want to cover. But the second thing is around education. So we've talked a lot around obviously the affordability piece, but a lot of times, I know, Lindsay, you've done some work also for I guess figuring out what is the health issue awareness, like just how women know about their health and how do they each know. So for example, I've had a very different experience where my mom took me to an OB and said, okay, you're going to listen to what this guy has to say to you. And it was a guy, a very uncomfortable situation. So I guess, like, how do you see this happening across Southeast Asia? And I know you've done a case study also around education, around awareness for health conditions.
Yeah, thank you for asking that. So when it comes to health, what women know about their health, menstrual health, puberty, and sexually transmitted infections, or STIs, are the top 3 female health topics that women in Southeast Asia are taught growing up, and that's primarily at school. So, if they are receiving this information, as younger generations, they're getting it at school. As older generations, we've touched on this, it's online resources. And again, that comes back to vetted information and making sure that the information is strong enough that's coming through. I think in general, I'm really excited about AI and what we're seeing like Hattie Health doing and other companies in femtech in the AI space. First of all, because I think the data that you guys are using is really coming from a ground up. It's not taking data kind of even that's already in these huge sums that can be biased. It's you're actually building the data from an unbiased perspective, or as unbiased as it can be. Data is always biased in some way, but as unbiased as it can be. And I think that's really powerful. When we think about kind of clinicians and medical providers, obviously very, very trusted and who we all look to for, for support. So the question is how much are we providing these incredibly busy clinicians and medical professionals with the information they need specifically about women's health? An example I have in particular for me was, so I'm in my mid-40s, I am approaching kind of the perimenopause years, and asking around and listening to webinars and reading books, and reading articles, almost everything said, oh, put together your panel of experts for everything from, your gynecologist to your dermatologist to your GP, and all of a sudden I'm thinking, how I really have to work quite hard to manage what is a pretty broad topic, which, by the way, an interesting stat on menopause is that, women in the US in particular, so please note I'm talking about the US now, spend an average of $20,000 through the lifetime on trial and error. So that's trial and error to try to find a solution for menopause. So it's the idea that we as women often have to put together a whole bunch of different, go to a whole bunch of different people, a whole bunch of different places to find something that works for us and then kind of piece it all together. So I think when we look at platforms in the femtech space, and where I'm really excited about femtech and the changes of the changes the industry are making, it's really around simplifying a woman's healthcare journey, that they really just have one platform, or maybe just a couple of platforms or a couple of products, but it really helps simplify so that women feel like they can take more ownership of their health, and moreover have a more holistic view of their health. Because all of a sudden, if what they have, they can take to the doctor and say, I've been tracking this in my app. These are the trends I'm seeing. These are the questions I have. If they have a place that they can track all of that, I mean, what a gift as far as being able to have better conversations with their doctors when it's more data and fact-based. So, perhaps I've talked a little bit about the case study, but I think it's more thinking about the value that having something as an employer offering an easy one-stop shop type platform that people can really trust the content and the offering, with vetted professionals, clinicians, and medical providers who can really support with the answers they need, and in turn create a profile to allow the consumer to be more empowered in their knowledge, awareness, and decision-making moving forward, I think is a very powerful part of femtech.
Thank you, Lizzie. I think that makes sense and that resonates a lot. I see there's a question in our chat box also, and I wanted to do something a little bit different. So one of the because the next 2-3 slides that we had were around surveys, and actually I want to open them as a panel discussion because I think everyone has like a very good point, and it's within the frame context of the question: why should companies consider supporting women in addressing their health needs? How could a more responsive workplace impact how women contribute in their business? So I think we need to make a more compelling case for workplace inclusivity of this benefit. So allow me to just share screen, and then please jump in. Lindsay, I know that some of those stats you know them very well, so just give me a second. So I guess these are some stats that we've talked about before extensively. So this is the Deloitte report actually that you guys have run together, and I know you're gonna talk about it a lot during the conference, the FemTech conference in Singapore in June. So this I guess there is a hidden, there's a lot of HR professionals actually do speak about the fact that sometimes they just don't see the problem. Like, no one is complaining to me about this. This sounds like a unique problem. And exactly the fact that there's absence of a complaint, it doesn't mean that there's no problem. And this is exactly what the study shows, because it does show that having a data sort of a black box, or you have like a blind spot, it doesn't mean that there's no problems. It's the fact that people do not want to complain about it because they don't want to appear weak. And you'll see here, for example, that we see that more than 40% of women do continue to work, although they're feeling a lot of pain. And imagine how that makes them feel in terms of productivity, or how supported they feel within their workplace, or what does that say about the culture of the place as an inclusive and as a caring organization. So we see that there's impact both in productivity, but most importantly also in the culture of the workplace. So I guess a case here we can make is a lot more, not just on productivity and obviously, gains for employers for the bottom line, but fundamentally it's like, is this a caring organization? Is it an organization that allows openness and then diversity and supports their employees throughout? So maybe I'm just gonna pause here and say, maybe Lindsay, if you have comments or would like to add something for this specific report.
Yeah, so this report was done by Deloitte. So I wish I could take credit because it's an incredible report, but they're actually our partner for our upcoming Femtech Connect Asia event that's coming up at the end of June. So they're actually creating another white paper coming out of that exactly on this type of topic. And Maria, I'm so glad you're going to be speaking at this event, because we are talking about integrating women's health into the workplace. And that'll be with a lot of our partners from around the region, like HSBC, Singapore Global Network, which is a branch of EDB here in Singapore. We have Cigna Healthcare. So we have some really big players coming in, and we're hosting the event at AWS. So you can see more and more large brands are trying to figure out how they're bringing women's health into the workplace. And I think a lot of it is what you're talking about here, Maria, and what you're reflecting on is looking at how do we create a channel that is confidential, and yet on a broad scale open, and that how do we have training within the business to allow those conversations to take place? So some of which we've talked about today is around allowing the employees access to these policies and to a stigma-free environment. A lot of this also comes from training our leaders in organizations. So making sure that our leaders are aware of the changes that are taking place in the business and making sure that they're sponsoring that change and sponsoring the growth and the progression of female candidates within the business, that they aren't being in any way ostracized or have bias against them for things that are out of their control, which is often our healthcare. So I think that would be the one thing I would kind of add to this statement, is saying that we look a lot at an employee and the employer, but actually a lot of it, and a lot of what's going to improve the situation, is making sure that our senior leadership teams, those management teams, are actually on board and understand in depth, what the impact of menstrual health and menstrual care is required.
Great. Thank you, Lindsay. The second one that we wanted to talk about is the McKinsey report. So very similar, and actually the interesting part that I found it extremely interesting for this report is investments. So a lot of the times we get asked, and this was actually the other question in the Q&A box earlier, it talks a lot around what is the cost? Like, what is the additional cost that employers have to shell out to cover for those benefits for their employees, and what is really what they're getting back? And reframe that a little bit. I will explain what is our cost, but I guess like in this case is what does it make sense for an employer to invest in benefits like Happy Health or like in a femtech solution targeted for their employees? Well, first of all, what we've seen and the McKinsey report confirms is that what you'll see is that there's a huge burden in the healthcare system that comes from some of those chronic conditions. And you'll see, for example, like menopause is like at the top. And then a lot of issues around mental health, and we'll see other chronic conditions. And I guess most HR professionals who have joined us today can also see from the number of claims that they receive from analysis of their own HMO data, they'll see a lot of like chronic conditions or other chronic diseases that a lot of employees are suffering. So they're maxing out their benefits. We get most of the times they leave certain other things uncovered because they're prioritizing in their sort of like what is their priority of needs for healthcare. Yet if an employee actually decides to make an investment in their employees' health directly, specifically for women's health, what we see is that $1 as an investment can return $3. And this not just like for the employee themselves, but in general to the economy. And why is this important? Is because you actually get a much better ROI than investing in something else for your employees. So you can see that there is a targeted and a tangible benefit. And I guess most of this is because you get the greater workforce participation. You'll see employees are happier, more productive, all around. They can find the benefits and the support that they need. And obviously, the most important part would be figuring out how to create an inclusive workplace through specific HR policies and workplace accommodations. I remember when first maternity leave was introduced in the Philippines, where I think we found a lot of organizations like scrambling to prepare for how to make workplace accommodations. Where do you set your lactation room? Certain things like that people do for compliance. So where we want to go is create organizations and support organizations as they grow, from going from a checkbox or compliance to actually creating a great workplace for their employees with an inclusive culture. And I think this is where it comes together both as an offering, but also as an HR support and an ally. And actually with some of those surveys that we run typically with the workplace, what we've seen is that really what employees are expecting their employers to do is really invest in their health as a health benefit. So really actually make a tangible investment in terms of the health offering. So what we see here is that review your HMO, review what other coverages are, and then see from your employees also what they need in terms of benefits. And then the second, awareness sessions and menstrual products in the workplace, which actually is something that we're going to talk about very soon. But the second thing that we have found in a lot of our surveys in the workplace, so we'd love to hear from both of you, and Lindsay, on this, is what we see is we do see that there's a lot of discomfort and disruption during menstruation days or due to other conditions. And then also we have seen that more than 60% of women are asking for greater health coverage for the employees. So I just wanted to see how that resonates with both of you. So I'm just going to open the floor to you.
I was on mute. So Lindsay, you mentioned earlier that you just learned of the word dysmenorrhea, but in the Philippines, it's actually quite common. I think this is like one of the first words you learn as next to period, and people just take it as, you know, take a painkiller and just go about your day. But what we're now uncovering with Hati Health is that it could be PCOS. You know, it could be endometriosis, but they're not getting diagnosed. You know, women in the Philippines are living with these chronic conditions unknowingly, but only because they don't have the proper guidance from, you know, their peers, their family, or even their managers and their HR managers of how to manage their health conditions. And we also learned that when it comes to menopause, women are just as unaware as they are about their periods. And so we're actually starting to see companies in the Philippines either conducting their own internal studies and asking for these specialized treatment plans, whether they be, you know, HR education awareness sessions for their employees, or actually finding, you know, like very specific treatment plans from like hormone replacement therapy to medication, and even to mental health consultations. This isn't something that we are telling them. In that regard, they're asking for it. And like you mentioned earlier, there is a need and a gap for specialists in the women's health space in all industries. From the insurance sector, we've spoken to insurance companies that have health packages geared for women, specifically for fertility issues or maternity coverage. They want to expand it to menopause, or to, you know, to cover more fertility issues from like egg freezing, but they actually don't know where the resources are or where the specialists are. The space is still quite so fragmented. And so this is the gap that we would like to fill for the HR as their partners, to help craft their women's health policies around this space. And so like the surveys that we're doing and the feedback sessions that we're doing and that we've been conducting is really helping us craft these like wider health coverage with specialized health benefits. Yeah, so that's what and so like there's so much that we can do still. And I guess for the people listening in this room right now, I would really suggest to get in touch with us if any of this resonated with you, because we are still in doing our R&D phase, and we would be very happy to learn about what you're experiencing personally and also in your own offices.
Maybe on to see, Lindsay, if you want to add something. Yeah.
Yeah, of course. Yeah, from my side, I think, first of all, I'm really excited, not in a good way, but I'm glad that you guys included chronic conditions. So 70% of chronic illnesses are found in women, though only about kind of 80%, or excuse me, but 80% of tests are done on men, which is a really interesting stat to think of how disproportionate that is. So thinking about, you know, women's health beyond the reproductive kind of cycle, I think is really important. I think when we think about mental health is something that it's not on here, but it's definitely insinuated by how difficult it can be for the workplace, that twice as many women as men suffer from depression. This is in the US again, but I'm sure there are some consistencies that we can make. And it's actually the leading cause of disability in women in the US. So when we think about, are we also supporting mental health as part of that broader scope of what health means? It's obviously very important. Coming back to cost and making sure that cost is considered, the average woman spends about $2,000 in a lifetime on feminine care, so on menstrual care. So again, we're looking at, that is a big financial burden. Or, you know, so how are we supporting that, at least when women are at work? So, you know, we talked about convenience and cost and trust, and that would be just something to think about. A couple other things I think about would be, one, employee resource groups, so ERGs. How are we really listening to our employees? It's one thing for us to make the policies. It's one thing for us to figure out how to make the culture more inclusive. But there's a whole nother side of it that if the majority of employees actually say, we just need menstrual care, we're not interested in fertility. So doing all of the work and investing in fertility solutions may not be the right solution. So I really echo what Aya is saying about making sure that we talk to our employees and understand what they actually want, which, by the way, will change in time. It won't be the same thing this year to next year. So it's making sure we have employee resource groups and voices for our employees. And then the final thing I would just say, obviously, Hattie Health has a ton of ideas around women's health policies and what those can look like. But really happy to kind of explore that further, even beyond what's included here, to make sure that you do have one of the most kind of competitive offerings as an employer, because what we're also talking about is employee retention. And an example of that I would have is that I have a few friends here in Singapore who would love to find a new job, but their benefits as women are so good where they're based that they're not going to leave their companies. So it's also a method of employee retention that we can think about, and adding to the cost of not just, $1 invested, $3 back. It's actually making sure that we know that not replacing an employee, not having to do recruitment, not having to spend time on onboarding someone new and training someone new, there is financial value to that. So I think that's another thing we can think about, is really employee retention as well, which is, and even brand reputation as somewhere that women want to work, as more women enter the workforce and the she economy gains momentum and strength. So just a few thoughts there, Maria.
No, thanks so much, Lindsay, and thank you so much, Aya, for sharing those thoughts. I think we've kind of like hovered around the whole topics of affordability, accessibility, but it starts first of all like with awareness. So now that we know based on stats, it's good to reflect and see and look inwards within our organizations and see how are we actually experiencing this problem. Sometimes we'll get very surprised talking directly one-on-ones with certain employees around it. But we just, for the interest of time, actually wanted to get the opportunity to talk a little bit more about how we thought also about what affordability could look like. Apart from the aspects of getting accessible healthcare in the workplace through our marketplace of experts, we wanted to introduce a new product. So I'm just going to turn over to Aya to talk a little bit more through about this new product that we wanted to launch.
Yeah, so from our surveys, the top 3 requests for a wider range of employee benefits was having free menstrual products in the workplace. And answering to that demand, we created this Hattie Health dispenser, which also comes with access to the Hattie bot, educational workshop sessions, and posters and flyers, just educating women about their health in the one place where they spend 70% of their time in, which is in the offices. We also saw this as a very strategic location for us to actually learn about her health, when this is a private space where you're actually most concerned about it, especially when those periods come unexpectedly, right? I guess this was our answer to how do we reach women in the most effective and impactful way, and just displaying and just having them in a display that was relatable, still within the times, and not your typical metal box that you typically see in malls that just ask for payments and hence comes out a pad. We saw this as an opportunity for employers to take charge of that conversation, to lead that charge more, and also I guess to practice what they preach about, really caring about their workplace. And so this is still a prototype that we have, but we're very happy to work on this with companies that might be interested in it. If you are, we do have an ongoing promo at the moment. So please scan this QR code so we can get your details. But I'm quite excited about this, and I really do think that it is a first step to educating women and meeting them where they need us the most.
Oh, Thank you. I see that there's someone having trouble with the QR. We can just send the link directly, maybe. Angel, if you want to put the link on the Q&A box. Thank you for reporting it. So I think this is something that's a lot of companies are now evaluating their return to office policy. So I guess interesting benefit to find in the office, how to make it more homey and more, I guess, more interesting for some people. We're thinking about replacing a water cooler conversation about, what did you do over the weekend with really what's going on with your health, and creating that small community of women who are supporting each other through their different health challenges. So I think we are on time. So we want to pause here and see if you have any other questions that you'd like to share with us. Please add in the chat box. We will share this presentation and then other materials also. If you don't mind and you have a couple of minutes, maybe if you can just give us your evaluation for this webinar, it will be very helpful for us in terms of designing other engagements in the future. And also we have a certificate of attendance after to share with you. Feel free to get access to our resources. So you can also reach out to us at hello@hati.health to book a session to go through a little bit in detail. But I'd like to take this opportunity to thank Lindsay so much for participating today and sharing with us your knowledge for Femtech and your experiences so far, and data points, because I think we need to go data first to be able to show to employers as to why it makes sense for people to work with us. And thank you for everyone who joined us today. I hope this was a valuable webinar, and looking forward to working with some of you if you find this very interesting. Thank you so much.
Thanks, Maria.
Thank you, Maria.
Thank
Thanks, Lindsay.
you. Thanks.